epidemiologists are better, can explain that to you better. Sometimes in one area, the outbreak is more severe. In another area, the outbreak is less. We frequently had a situation, we did it with Omicron BA.5, where the outbreak was focused in the Northeast in the United States, New York, Massachusetts, Connecticut, spread a little bit down to Florida, but not very severe anywhere else. We had a few outbreaks that were focused on Minnesota, really bad. The rest of the country, hardly anything. And I don't think anyone has a good explanation why certain countries got much worse than others. Maybe the epidemiologists here will be able to help us understand why, except for South Africa, the continent of Africa, almost entirely spared. Very, very, very few deaths in the continent of Africa. Despite all the cries about how we weren't paying attention to them, but they didn't have a lot. On the other hand, upper middle income countries and lower middle income countries like Peru or Indonesia, they did very badly. Indonesia's #1 deaths. Peru, the highest deaths per population. That means that we should not, we should have some national policies, don't get me wrong, but they have to be tailored to how severe the situation is in each locale. Otherwise, again, you lose trust because people in an area that isn't very severely hit will be suspicious if they're having severe restrictions but not a lot of disease. We can continue. One of the things that happened during COVID was stopping schools, sending all students home, going onto Zoom, and having classes, right, electronically. We don't have to do that. It's a mistake to do that. Students lost a lot of education. Students also lost a lot of friendships and things that prevent anxiety, depression, and mental health problems because of loneliness. We can avoid disrupting schools. Maybe not 100% during certain surges, but vaccinating teachers and students, improving indoor air quality, whether opening the windows, improving the ventilation, or putting HEPA filters in rooms, reorganizing lunch, gym, music classes to reduce aerosol spread, have kids spread out or eat lunch outdoors, use testing, and wear masks during surges. All of those things can be done to keep school open as long as possible. That's not to say that there won't be some cases and some circumstances under which we may need to close schools for short periods of time when there's a severe surge. But the idea of a whole semester, 3-4 months off, we don't need to do that ever again. Minimize social isolation. One of the consequences of COVID was people staying at home, being isolated. We know that social isolation is one of the worst things for people. The internet is already doing a very good job of keeping people isolated. We don't need to make it worse. Social isolation causes depression. It also causes a loss of social skills. I don't know the situation in Taiwan. I can tell you among my students at the University of Pennsylvania, they've forgotten how to talk to people. It's a serious issue, right? One of the things that happened is during pandemics, lots of public spaces, parks, beaches, playgrounds were closed. There's no reason, right? If it's aerosol spread, yes, it can have some spread outdoors, but not a lot. We should keep places, especially places where you can be distant, open.